think that's the thing, right? The fact that I did open a private business, and me being a young Seychelle was me like saying, I'm not going to be suppressed, I'm not going to be pushed down, and I'm going to do this. So that in itself put me in a position, kind of put me on the spot as well. The backlash was more with criticism. I remember that I did go to that person that was, um, the one of the main people in the field, and she was very against having me there, and she was not happy to even have me there, and around. And she made it very clear, like she expressed it to me, in very abusive ways, I would say. And it really hit me how this situation was, because I think like for a very long time I was very sheltered, I think, because I grew up in a family where we didn't really focus on a lot of these things. Like we didn't talk about these things, and I don't think we thought about these things, like how the system is really not available, able to give us everything that we need. It was only when my niece actually, we started noticing that she had delays in her development, and the schools didn't know what to do with her. They wanted to actually kick her out, and then there was a lot of difficulty going on there, that we really opened our eyes to the reality. And the backlash didn't affect just me, it affected my family as well, because my niece was supposed to get diagnosed, and I remember her parents went to get a diagnosis in at the hospital as well, in the government. And they went through an abuse, basically verbal abuse, and they were really distraught, actually.
Verbal abuse because you started your own business.
Yeah,
which
so
is crazy.
yeah, and all of that was my niece witnessed that. She was there in the room. She was told that she was it was being told about, like, things were being told about her in front of her, like she's probably just stupid or something like that, and things like that. And that abuse in itself was like, it opened my eyes to how people who decide to kind of go against things without even, wasn't even my intention. I wasn't intending to be like, oh, I want to prove to them this. I was just thinking, you know what, they need help, they don't have enough people, and clearly I wasn't able to get a job. I'm not going to get a job, so I'm going to do this privately, but I'm still going to do this in Seychelles. So it's still going to be available, and I'm still going to be offering something to help relieve the load. That was my logic. But I realized that in doing that, I kind of opposed, I guess.
Which is crazy.
So,
it's a crazy way to think about it. It's such
Yeah.
a strange mindset, because anybody should be able to come and start their own business, and you don't even have to justify why you want to start your business.
Yeah.
But we really do have a culture in Seychelles of putting people down and not wanting others to succeed. And I think I know who you're talking about, and
Yeah.
from what I've heard and I know, it's happened to quite a few people in the field from the same person. And it's something that we see across the board. And I feel like this is something that really needs to be challenged and brought to light, because it's completely unacceptable. We
It
want
is.
to empower the youth.
Yeah. I don't think it's just about the youth, because we don't cooperate with each other. We don't work together. Like, I've been doing this for a year, and the amount of resistance to even, let's come together and do this as a group. It's that mindset of like, I don't want anything to do with doing this as a group. This is my thing. I'm doing this for myself. And you can see that. I think the shift has gone. The mindsets have shifted away from, as health professionals, we have an oath to to help, to practice, to serve, to not do it at the detriment of our own health. But we have an oath. When you do this job, when you take this responsibility over people's lives, you have to realize the amount of responsibility you have, and how you are responsible to people, to your clients.